Second white coat. Subscribe and like. Let's learn medicine together.
All right, welcome to The Explainer. Today, we're basically going to become medical detectives. We're going to solve a mystery. And our case file is all about a headache that's so intense, it's known as one of the most painful things a human can experience. So let's get into it and crack this case.
So let's get right into it and meet our patient. She's 21 and she's in absolute agony from a headache. But here's the thing that's really weird. It's her reaction to it. She can't stay still. She's pacing the room. Now, that is not what you typically see with a headache, and that right there is our very first major clue. Okay, Section 1, the case file. To figure this out, we have to treat it like a real investigation. Every single symptom, every behavior, it's a piece of the puzzle. So let's start examining the evidence.
Okay, look at this pattern. The pain is just brutal, yes, but what's really strange is how short it is, only about an hour. And it's relentless, hitting her every single day for 3 days in a row. You see that grouping? That's our first big hint. It's why they literally call them clusters. Now add in that intense restlessness and a physical sign like a drooping eyelid, and a much clearer picture starts to emerge.
So, with these facts laid out in front of us, we're moving on to Section 2, identifying the suspect. The evidence is pointing very strongly in one direction. It's time to put a name to our diagnosis. And the diagnosis we are zeroing in on is a cluster headache. You know, the name itself is a pretty big clue, right? It refers to the timing of the attacks. But that second part, trigeminal autonomic cephalalgia, I know, it sounds super complicated, but it's actually the key to this whole thing. It's just a fancy way of describing a headache that messes with a specific nerve and some of your body's automatic functions. Okay, so we've got our suspect, the cluster headache. Now for Section 3, decoding the classic clues. You know, any good detective is going to double-check their work. They match every piece of evidence to the suspect's profile. So let's do that right now. First up, the clock. When you're diagnosing headaches, timing isn't just a minor detail. It's everything. It's one of the most fundamental clues that helps us tell one type of headache from another. And bingo, it's a perfect match. Our patient's hour-long attacks fit squarely inside this classic 15 to 180-minute window, and the fact that they're happening every day, well, that's the very definition of a cluster. This is a whole different ballgame from a migraine, which can drag on for hours or even days.
All right, next up, let's analyze how she's acting during one of these attacks. This is honestly one of the most dramatic and telling clues that we have.
You see, her need to pace the room isn't just her being anxious about the pain. It's a hallmark symptom of the condition itself. Think about it. When you have a migraine, what do you want to do? You want to lie perfectly still in a dark, quiet room, right? Well, a cluster headache patient feels this overwhelming, irresistible urge to move. It's a night and day difference. Now for Section 4, the usual suspects. Look, a huge part of any investigation is ruling out other possibilities. To be 100% sure about our diagnosis, we have to put it in a lineup next to other common headaches.
And this is where that contrast just becomes crystal clear. Her behavior alone is an incredibly powerful diagnostic tool. On one side, you've got this restless, agitated energy of a cluster attack. On the other, the complete stillness that a migraine sufferer is looking for. Honestly, you can often tell the difference just by looking at the patient.
This table just lays out the whole diagnostic picture perfectly. I mean, look at the clear differences in every single category. Duration, minutes for clusters, hours or even days for migraines. Behavior, restless versus wanting a dark room. And pay very close attention to that key buzzword for clusters, ipsilateral autonomic. We're about to find out exactly what that means, because it's the real game changer. So, this brings us to Section 5, the telltale sign. Okay, the timing and the behavior are super strong clues, no doubt about it. But there is one final piece of evidence, the clincher, that is so specific to cluster headaches, it basically closes the case for us.
So think about it. If you had to pick just one single sign from our patient's case that just screams cluster headache more than anything else, what would it be?
And the answer lies in that weird term we saw a second ago, autonomic symptoms. Specifically, symptoms that happen on the exact same side, or the ipsilateral side, as the head pain. So what are these things? Well, they're signs that the body's automatic or autonomic nervous system is kind of going haywire. And our patient's ptosis, that drooping eyelid, that is the smoking gun.
Other signs could be tearing, a stuffy nose, or facial sweating, but again, all on that same painful side of the head.
And this is why it happens. It all starts deep in the brain in a part called the hypothalamus, which basically acts like the body's master clock. That explains the cyclical nature of the attacks, right? This then activates the trigeminal nerve, and that's what causes that insane pain. And that, in turn, triggers an autonomic reflex, which leads directly to those physical signs like tearing and the drooping eyelid. All right, on to our final section, your final diagnosis. We've gathered all the clues, we've identified the mechanism. Now let's just boil all of this down into a simple, powerful takeaway that makes this diagnosis unforgettable. And here it is, the diagnostic signature. If you have these three things together, one-sided pain, that urge to move, and those one-sided autonomic signs, you have a cluster headache. It is a powerful and incredibly reliable formula. But of course, getting the diagnosis is just the first step. Treatment is the real goal. For an acute attack happening right now, you want rapid relief. And believe it or not, high-flow oxygen can be incredibly effective. But to stop future attacks during a cluster period, you need a prevention strategy. And that's where a medication like verapamil comes in. Knowing these two very different approaches is just as critical as making the diagnosis itself. So, after looking at all the evidence, after going on this whole diagnostic journey, what is the single biggest lesson we can take away from all this? And there it is. While the pain is horrific and the restlessness is really dramatic, it's the presence of those autonomic symptoms on the same side as the pain that truly sets cluster headache apart. That drooping eyelid, the tearing, the nasal congestion, that is what confirms the diagnosis beyond a shadow of a doubt.